So you have a program where other dentists can learn implant dentistry from you. Tell me a little bit about the program.
So the way, like I said, I got inspired by many leaders and experts in the field of implant dentistry. So what I did, I went through all their courses from the best teachers in the world. I read their textbooks. So what I've gathered is, what I loved about their courses was not just teaching implants, but also teaching how to restore implants. But not only doing implants, because it's fun doing implants, but they need to know how their assistants, because it's a team approach, right? So they need to know that their assistant can handle all of this, or their team can handle. Now we help with marketing, we help with all kinds of financing and what patients can do or what these dentists can go through, because at the end of the day, it's not about the dentist knowing how to do implants, but it's also being able to integrate it with their team. So that's the whole concept of approaching and doing this teaching, educational live surgery. So I do live surgery. It's not just about the science of how the bone is and the physiology and everything. It's about how you actually feel the bone. No matter how much you go through reading books and going to classes and weekend courses here and there, as long as you don't touch and do live surgery, you're not going to get it. Because you're going to go to these courses, you're going to spend so many thousands of dollars, go back to your practice, and then you start, oh my gosh, this is so different than that patient that I saw. So what I like to do is to teach them the way that I learned, and that was through live surgery. So I teach them live surgery.
Now, people can find you for dentists on Instagram.
Correct. So
also, you have a podcast.
Right. So we have a podcast called Millennial Dentist Podcast, and it's awesome. It's actually got so much feedback from a lot of people that I didn't even know. But we get a chance to talk to a lot of different generation, because there's a gap between older dentist and the younger dentist. So we want to close that bridge. We want to close that gap because we're millennials, right? We learned by the iPhone and the whole concept of we got a bad rep of like we're self-entitled, for example. But it's not so true. There are so many people, millennials, that are very good, and it's not our fault that we grow up by not answering phone, by texting. But let's get that and use it with the old dentist experience and put it in the same practice. Let's learn from each other, from the experience of the older dentist and the technology of the millennial dentist. So we put this podcast together and we talk famous people, and it's awesome. I love it. We almost got 30 some episodes and keeps rocking.
So what are you teaching in the live teaching?
Yes. So
are they streaming videos, or what are they?
So yes, we do streaming videos. We also like to do Instagram, for example, if the patient, because many of my followers on Instagram, I love to be able to give back to so many folks and supporters. So I do live stream with the company called Implant Compare, and what they do is live stream my cases. So we broadcast in the last time 80 countries. That we had people that he had folks that were tuning in, and we do live surgeries. So that's what we do for the other folks. But if you can come in, either in Nashville or Arizona, Brighter Way Institute, we could teach live surgery on doing full mouth rehabilitation and all kinds of stuff.
Now, most of what you do, because we've had you on the program, is you do fixed teeth.
Correct.
You're not big on the snap in, snap out. Is that what you're teaching at these courses?
I teach both. Because there are people that come in with some of the dentists that are not living in the area or demographics that cannot afford the fix, for example. But the thing is it's not the fixed or removable. It's for them to know the foundation. It's for them to be able to integrate what they can learn and be able to do it at their office. So what we do, I like to monitor my students. So what I do, I talk to them over Skype after they're done. We're like, hey, tell me about your surgery. Now let's treatment plan this patient together. So we have a Skype session where we treatment plan cases. He's in Texas, he's in Arizona, he's wherever he is. I'm in Nashville. We're talking about the course, the case, and the x-ray. We go over them and he's like, what do you think? And I'm like, what do you think? So we go over it back and forth, exchange ideas, and that's how people learn. Not just by one weekend course coming back and dropping screws.
So what's the best way for somebody to find out more or get involved?
The best way to contact me is honestly through my website, mynewsmiledental.com. That would be my office that would contact me to tell me that, hey, this person is interested. But I have my website and everything is being built as right now. However, Instagram is also another platform that I'm very active on. It's Dr. Raissi. So we have it listed on the show. We could have it Dr. Raissi so they can contact me through there.